Okay, so there are several things that I think pharmacists can do to help overcome these barriers. The first is being educated about patient beliefs. What are the common barriers that patients are talking about and what's kind of in the media, so that can help the pharmacist be educated and develop a spiel to counteract that barrier. The second thing I think is really listening to patients. A lot of times when they have a question or a concern about vaccines, providers brush them off. And so if you really take the time to listen and try to understand their perspective, they'll definitely feel better about the pharmacist. The third thing I think is important is give a strong recommendation. So this relates back to the previous question where we talked about lack of a healthcare provider recommendation being a reason for not receiving vaccines. If you make the statement, as your healthcare provider, I recommend that you receive this vaccine, patients are much more likely to accept that. And lastly, I think making sure to discuss both the benefits and the risks of the vaccine are important. If you only focus on the benefits, that's very one-sided and the patients might seem like something's being left out. So I think it's good to talk about all four of those things.